A lot of patients that we see complain about distressing symptoms of the vaginal area, whether it is itching, burning, soreness, dryness, or painful sex. They are fed up and frustrated because despite repeated treatments, which seem to work for a short while, symptoms come back with a vengeance. In our video today, let's discuss about vaginitis or vaginal infection. What are the common causes, its symptoms, and the ways to prevent it? Hello, I'm Dr. Urvashi Sehgal, and I am an obstetrician and gynecologist with over 35 years of experience. Let us begin with understanding what is vaginitis. Vaginitis is an inflammation of the vagina, which can cause itching, soreness, burning, discharge, and odor. Vaginitis is very common and age is no bar. So even though the vagina is a self-cleaning organ that maintains a delicate balance of the bacteria and yeast, when the balance is disrupted, it can lead to recurrent vaginitis. You might be wondering what causes the disruption. In other words, what causes vaginitis? Number 1. Bacterial vaginosis, that is an imbalance in the vaginal bacteria where harmful bacteria overtake the healthy ones like lactobacilli. This can happen due to taking antibiotics, douching, using an intrauterine device or an IUD, low immunity due to any reason. Number 2. Yeast infection, commonly known as thrush. And this is caused by an overgrowth of candida, a type of yeast commonly found in the vagina. You may have too much candida growing in the vagina because of antibiotics, pregnancy, diabetes, improper diet, and alcohol. If your partner has it or is diabetic, you can get it after sex. Number 3. Vaginitis may be caused by infection, those that are sexually transmitted due to unprotected and unsafe sex and multiple partners. Example, trichomoniasis, herpes, chlamydia, gonorrhea, and several others. Number 4. Vaginitis caused by allergic reactions. So sensitivity or allergy to certain products such as soaps, detergents, perfumes, or latex can cause allergies leading to inflammation. Number 5. Hormonal changes. Fluctuations in hormone levels, particularly high progesterone during pregnancy or low estrogens in menopause, can disrupt the vaginal environment. Even little girls, due to their very low estrogens and proximity of anal area to the vaginal opening, can get vaginitis. So what are the common symptoms of vaginitis? Itching or irritation in and around the vagina, abnormal vaginal discharge that may be white, yellow, or green, vaginal odor described as a fishy odor more after intercourse, burning sensation in the vulva not restricted to urination, and redness or swelling of the vaginal area. Pain or burning sensation during intercourse is also a symptom of vaginitis. If you are experiencing any of these symptoms, whether it's for the first time or repeatedly despite treatment, it is suggested to seek advice from a specialist. Very often, patients ask me if vaginitis and its recurrence can be prevented. So let's talk about prevention and the management of recurrent vaginitis. First and foremost, practice good hygiene. But that doesn't mean scrubbing the vagina with a strong antiseptic soap and solution, but because that kills the friendly protective inhabitants of the vagina, its microbiome. Therefore, avoid using harsh soaps, douches, or scented products in the vaginal area. Wear breathable underwear, choose cotton underwear, and avoid tight-fitting clothes that trap moisture, creating an ideal environment for infections. Avoid irritants. Be mindful of potential irritants such as synthetic fabrics, perfumed sanitary pads or tampons, and strong detergents. And if you are allergic to latex, avoid it like poison. Practice safe sex. Use barrier methods such as condoms to reduce the risk of sexually transmitted disease, for that can contribute to recurrent vaginitis. Seek medical advice. If you experience anything unusual, do not ignore it. Ignoring never helps, but the right treatment at the right time does. Consult a gynecologist for an accurate diagnosis and appropriate treatment options. With this, I will sign off now. Stay tuned with us for more information on gynecological and reproductive health subjects.